afternoon. I'm Fogarty from HumanCentered Design. I appreciate you taking the time out of your day this afternoon to spend some time with me, have this conversation about human-centered design. So a little bit on this topic. We chose this title because we're really trying to help people understand the foundational need for human-centered design, human factors engineering, and all the processes that come with it. So increase the probability of success. And really, what does success mean? Could be increased revenue, could be safer products, products that users enjoy working with, get benefit out of, and that return actionable data, particularly in healthcare, and go back to other users such as the healthcare provider. And it's also about reducing risk, which could mean failure of devices, harm to an individual, but it could also mean project risk, such as schedule and budget. Because there's an interplay, of course, between the engineering, the design, and the humans that are going to be using this, that if you work that early into the process, you can eliminate a lot of risk, buy down a lot of risk, but importantly, have the transparent discussion about when those decisions need to be made and how, rather than dealing with the after effects. And we'll look at some data about the after effects when you don't do that. So there's an interesting study from DMI about the Design Value Index. And they went in and looked across companies that they could quantify how much design effort, what kind of revenue was put into actually proactively the design of a device versus companies and products where design was not really incorporated. And they looked at the value of those companies on the S&P index. And I thought this was a really great quantitative way to show value, because often I'm dealing in a world of cost avoidance, and it's really hard to have someone, entice them to invest $1 today, especially for a startup that is highly compromised about the choices they're making, to save money in the future. And it's all about probabilities, because the bad thing may not happen, but I actually come from 20 years of human spaceflight experience. It was like, well, do we know why the bad thing didn't happen? Because you could have been lucky, but you really should be good, because your luck's going to run out eventually when you work in the world of probabilities and lots of people using your device. Suddenly, all those things like the phase 4 post-market surveillance show all those vulnerabilities and weaknesses that may not have come up in early and limited testing. So the data really starts to show that you have safer products, no doubt about it, more innovation. And that's actually going to come out of some cultural phenomenons that when you bring teams of people together across product development and you give them a voice, and the cross-section of discipline is really where the solutions come from. That when they're working kind of in their swim lane or stovepipe, they just know how to solve the problem with the only way they've ever looked at it. So when you get another group coming to the table, they can give you a different perspective on how the problem might need to be solved. And also, the tension between the needs, between design, cost, budget, all the different drivers. And again, there are choices to be made. There may be more than one right way to go, but we should know what those choices are, and that we're all deciding to go in a certain direction. I think the higher profit margins bear out by this type of analysis. Faster growth, and that's really more related to user acceptance and your performance in the market afterward. If you have a really good tool and the user can use it and the data is moving the way it should, the product will sell itself. It'll show value back. It will be actionable. It will be value. I came from a talk earlier from Dr. Ina Sawyer, and she has a nuisance or value to nuisance ratio. That's what she calls it. And she's working in the world of digital health and remote medicine at this point. And she's like, if you are less than 1 in that ratio, you're not going to make it. You have to drive the value up and keep the nuisance of problems and complexity down when it comes to the user. Greater market share also goes back to the product selling itself and becoming a problem solver. It's really solving the problem it was intended to, and it might even have greater application than it was originally intended. Positive public opinion matters. In the age of social media, someone's opinion or experience with something catches on quickly, and of course, when you read something from someone else, you can't unlearn it. So the next time when you go to interact with a device or a product, that's already a bias. Like maybe your expectations are already set to find the flaws or the problems. So So it's interesting, if you can abate that and keep that from happening, you're going to decrease the bias, and someone can experience it without having someone else's opinion weighing heavily on them. And again, culturally, the employee engagement, talent retention comes out of the cultural phenomenon of people having a voice in the team, of their perspective on what needs to happen in the design and the use of the device, being present in the decision making about how this is going to move forward, as opposed to just the schedule making a decision, or just the budget, or just an engineering limitation. The other way to start to discuss this with folks is about the 1-10-100 rule. And this is coming out of Amy, of course. And this is really going back to that discussion of cost avoidance and trying to really help people understand the benefits of preventive investment in a device development. And these numbers are coming out, prevention is about a dollar on the dollar value statement. Corrective costs, and and again, to say these could be highly underestimated if we could get a good case study and a controlled, the same device developed two different ways and run them side by side would be an interesting study to do. Never going to happen, but we can probably find examples out of the literature and early on that can help us understand these numbers a little better. But I think the scarier one is the failure cost, because some of these are invaluable. The loss of human life, the loss of a limb, just at some point, dollars are not going to make sense in that discussion. But that also goes back to future, because this company, your reputation, your credibility, your ability to move forward can be hampered by having something that failed at such a large scale. So in the human-centered design approach, we're trying to understand and consider the entire ecosystem. And it has its roots, I think, really in the systems engineering approach. You're going to sit each of the component, the subsystems, down simultaneously and negotiate requirements, design drivers. And they can still be qualitative things in terms of aesthetic features. But how are you going to balance across all of the needs and wants? And again, going back to, schedule and budget every time. So our company, Sofix Synergistics, has a diversity of talent on board that can represent expertise in any one of the areas. So as a company, we come to the table not as a single individual, but as an approach, and then we can matrix how we supply our talent to the team that needs us. Because the other issue, especially with startups, is cost burden. So you're trying to manage it and make it a reasonable resource that is accessible to them, and have discussions with investors and accelerators about offering this type of capability up front is going to really help these startups succeed. And I say that, but I also believe if you're going to fail, you should fail for the right reason, meaning it really didn't work. Because failing for the wrong reason, we have tons of technology and solutions that, because the right homework wasn't done, or the right problems weren't solved or mitigated early on, it could have changed the world, but it'll never get another chance. It was put aside, it has a reputation, or it has some baggage with it, and it may never be revisited. The other element is, and we're going to get into this a little bit, about macro and micro cycles within design. That is not an all or nothing proposition, but going back to that first pyramid, where cost savings are magnified when you do it earlier. Because downstream, when you have bent metal, put something into production, even later prototypes, the costs that have already been invested, you're probably going to resist some elements of redesign that could be really important because of all the costs that would go into, and all the costs that were lost, or the investment that was lost. So again, it's a negotiation of how we move this forward and really figure out what is the right trade space amongst all the areas of the company or the design that require investment. So in the human-centered design approach, we look at the design process. We're going to respect how that process needs to go. We're not trying to affect that, but we're trying to work kind of seamlessly with it by applying a variety of our capabilities. And our company also has expertise not only with certified human factors professionals, but people who work in applied health and also extreme environments. Where in extreme environments, I think you might agree that it really puts a critical edge on what is needed. So again, in my background with human spaceflight, the failures, you don't get a second chance. So the work that has to be done up front to ensure robustness, continuity, the ability to repair and replace, they all kind of hone in on making these negotiations about how you work it along the way so that you have engineered out the problems. And we're all geared toward the same results, preventing injury and death, reducing the risk of errors. These are not mutually exclusive, I totally understand that. Increased efficiency of operations, and that's another value add. If it takes less time and effort for someone to operate your equipment and it is safer, that's also something that's going to engage them and increase your marketability. Reduction in workload, the same thing. Often people, like in a hospital setting for sure, the workload is incredible. You can come in with a great solution, but if it's another 20 minutes and you have to read 5 pages of procedures, it's just not going to happen. It's not going to reach that threshold of adoption because it complicates their life, even though it's a better solution per se. And of course, everyone's geared toward improved patient outcomes. I also try to think through this in terms of home health care, telemedicine. And so even though something might be geared to a hospital setting, clearly the pandemic put a very specific pointer on the fact of, well, if we could get it into the home and just get the data back to the healthcare, we don't have to risk the exposure to people if they don't have to come into the office. How can we make sure they can operate the equipment or their caregiver can? If it's the individual patient, they could be compromised, cognitively. So how do you make it available to them and actually actionable by them, and then deliver the data back to the healthcare provider so that they can make quality decisions and improve those outcomes? So going on to this concept, again, there is not an all or nothing proposition. So we have these macro and micro cycles against kind of the standard design set of design activities, where we take the conceptual phase. What are we going to do? We're going to do research if the company already has it. My favorite part of the work is actually gap analysis, because it sits in a couple of different spaces. You pretty much have categorized the problem you're trying to solve, and then your solution itself will have to be analyzed for, well, how much evidence base is behind it. What is the rigor? Has it been used in the population it's intended? Are you crossing adoption across kind of application lines so that it's coming into a new user state? So those are identifying the known unknowns. That's the other gap. And the larger space, which could be kind of frightening, and I think people kind of pull back from it because it is like, well, this could be endless, was the unknown unknowns. The deal isn't you'll never be able to figure them all out, but you should at least be able to draw a box around them. Like, start to give yourself the freedom to say, what are the things we should speculate on and kind of have some context about so we have some better informed decision making. That takes a little effort. Surveilling the literature, going out and looking at devices or the solutions that have been put up against the problem before. Just any way to kind of characterize what that space might look like to raise your awareness. And I think also importantly, getting it back in front of the diverse population that's bringing some parts of the solution forward. Because engineers have a very different perspective than the phlebotomist who's taking blood versus the doctor who's reading the lab reports versus the nurses at the bedside. And they all have a role to play in this, and those are the boots on the ground. Like, how do we get them involved in actually having discussions about this level of product development? Market and bench analysis, very important. The next one is focus groups, but that's really code for user research. And I always try to remind folks, you might have more than one user, which makes it pretty complex. Going back to your user in a home healthcare sense or telemedicine could be the patient themselves, with a variety of levels of abilities and environments that they're working in. And the other user is the healthcare provider who needs the data back from that. And potentially another user is the insurer who needs the data to decide exactly how is this going to get reimbursed. So you at least have to identify who those users are, what are their needs, and what is the best way to deliver back what they need. Not necessarily deliver them what they've always received, but what do they need? And sometimes that's another job layered on top of the device or the solution itself. But it's important to at least know that. When you get into design requirement phase, that can be really interesting because now you're talking across lines and having to have medical people talk to engineers. And I used to work as a translational scientist, and that's all in quotes. because supposedly we were all speaking English to each other at the time. But the terminology, you could totally agree with each other and never know it. And one of kind of my examples would be we were working with a lot of imaging technology, and the engineers wanted to understand the pixel density that was required by the physicians to be able to diagnose something. It's like, I don't think a physician's going to be able to articulate pixel density, but if we could show you what a quality image looked like that has diagnosable characteristics, then you as an engineer maybe can, understand what that quality was that meets their need. And now we can get to the place where everybody's having a conversation to get to the end point we all want to get to. Now, the design drafting phase is, again, where you're reaching another level of maturity that depends on a lot of components of your user. So I think that second line is important, where it says task and cognitive walkthroughs, because that's where you can have a lot of mismatches between expectations and reality. Especially when the designer has focused on what their capabilities are and they're kind of internally testing the prototype and it's working really well. And then you're going to hand it to a 65 or 70-year-old person with arthritis who has never worked with a smart screen before. And can they actually operate the device to the degree to which it makes sense? Or can they even see the numbers or understand what the bezel means? And we've run into products where that became the greatest rate limiting factor. The software was amazing, the interface looked good, but when you went into the population, they had other limitations that was going to make the outcome they all desired impossible. So verification and validation is that endpoint where failure is very costly. So when you get that further down the line, you should just be refining your tool. Your testing should come back, and it's not that you can't go back to the beginning, but as you can imagine, in the macro and micro world, the further this cycle gets out, and if you're having to go back to design requirements, that's where you're going to hit your highest cost to go back and review. And it's also going to prolong your schedule, which will impact your budget. And that's where hard decisions are made about what your priorities are. And again, it's not that someone like our company and the expertise we bring tells you the answer. What we do is give you the analysis and provide recommendations that tell you, depending on kind of like a sensitivity analysis, depending on where you decide to make that reinvestment, here's how the return is going to happen. And so you can pick options like, do you want a longer schedule? If you want to compress it, you better find more money. And at some point, money can't buy you everything. So some things may just take time. So what are the areas that you control, and which ones are the ones you do not control? Data analysis. My world revolves around data. I almost think there's nothing as too much, but it can get pretty unwieldy. So you usually have to bring in some tools, because it's really about, you better have thought through exactly what it is you need and want to know to structure the analysis you're going to do. What I will say, though, is, and kind of my caution when people say, I don't think we need that data, when they're saying that up front, you're like, we'll never know. What we'll know is, you'll be sorry you didn't get it later. So in terms of, again, cost and time and complexity, if you can include more data collection along the way, either with the device, with the user groups, it really helps enable as much analysis as possible. So I really believe that human-centered design can be both agile, efficient, while it's being integrative and iterative. So mostly people are like, well, if you're going to try to do iterative and integrative things, they're complex, they're kind of a large group is going to have to move together. But given you come and go from a human-centered design, human factors engineering expertise, we intersect with the group, we do the analysis, we're providing the recommendation reports. The people who control the business make the decisions about the path forward. The team goes off, does the rework, and then we get back together at another milestone and reiterate the process. And if the team knows exactly what they have to go off and do, and they're working amongst themselves when they've been given the recommendation, we can move through those milestones pretty quickly. But again, any one of these timelines could be prolonged if there has to be major redesign, or if you've reached something where you're at a limitation from technology, so you're going to accept more risk, or you're going to accept another way to bring in a solution, which may mean training or procedures. It's not ideal, but at least you know what decision you had in front of you. So really, overall, we have a variety of benefits, I think, that human-centered design offers, in addition to a value statement and in addition to risk reduction. And I think that goes back to the culture of the team, where you're going to drive people to have those cross-disciplinary discussions and drive the conversations so they understand each other and don't feel like they're competing for the same assets, but they're all driving toward the same goal and understanding maybe where the push and pull between them could arrive at the best solution for the company. So I really appreciate your time today and your willingness to listen. Here at SOFIC, where Lisa Hawkins, my colleague, are here in person and would love to talk with you and answer any more questions. So thank you.